Good evening, ladies and gentlemen. On behalf of the Ladies Study Group in Kolkata, I would like to wish you all a very warm welcome on this very special session today. We were scheduled to have the Honorable Member of Parliament, Srimati Supriya Suleji, joining us from Mumbai. She was all set to log in and got a call because, as we all know, her father, Shri Sharad Pawarji, is in hospital and she has had to rush there. So, unfortunately, she is not going to be with us, but she sends her best regards to us and hopefully will join us at some later date for another occasion. But we decided to go ahead and celebrate this very special occasion. And so I'm going to take it forward from here. The awards began in the year 1975 with the institution of the Ladies Study Group Charitable Trust and the initiation of the annual award scheme. This scheme recognizes the outstanding initiative and the selfless dedication of charitable institutions and similar non-government organizations who work towards uplifting the lesser privileged sections of society. Nominations are requested from organizations and a specially constituted panel of jurors comprising the eminent citizens of the city finalize this awardee. For our 2020 LSG Charitable Trust Annual Award, we had invited nominations from registered non-government organizations and institutions that have supported and worked to improve the welfare of women and children in this very difficult COVID times. And I am so happy to announce that the jury selection for the Ladies Study Group Charitable Trust Award for the year 2020 is Calcutta Rescue. Can I please request Mr. Jaydeep Chakravarti, the CEO of Calcutta Rescue, to join us on screen?
Hello, hello dear.
Congratulations, Jaydeep da.
Thank
And
you
before
so
we
much.
proceed, I would like to request our technical team to play the video which showcases your incredible work.
Hello, Namaskar. I am Joydeep Chakraborty. I'm the Chief Executive of Calcutta Rescue. We are an organization that serves the poorest communities in Kolkata and the surrounding districts, and we were founded by medical doctor, Dr. Jack Prager. The pandemic has distressed our beneficiaries in ways that we haven't seen in our 30-year history. The decimation of livelihoods and income has left mothers wondering where their next meal is going to come from and how they're going to feed their children. But through our healthcare, through our mother and child program, through our education program, and through our handicrafts and livelihoods program, our staff have provided services to our female beneficiaries. The old man is snoring. He went to bed. On behalf of all of us at Calcutta Rescue, thank you so very much.
Thank you, Joydeep da. And we request you to stay on screen with us. I would like to announce all the awards and then I would like to ask you some very interesting questions about your work. So I would like to continue now. and announce the Shanti Devi Khaitan Award and the awardee. The Shanti Devi Khaitan Award was instituted in 2017 to financially support the education of underprivileged girls who show a keen interest and a commitment towards their studies. This year, under this scheme, the Shanti Devi Khaitan Award will support the training of two lesser privileged girl students at the Woodlands College of Nursing for 3 years. I would also like to share that the Ladies Study Group has been in existence for more than 50 years, and we have always stood strongly by society. We have made the best efforts to react promptly in emergency situations and provide meaningful help to people in distress through our donations. We feel both honored and humbled to have contributed almost 25 lakhs to different organizations to support their relief work. We began by making donations to support the relief work done by the NGOs Goonj and Project Mayuri of Calcutta Foundation post the devastation caused by the terrible cyclone Amphan. And today, we are so happy to announce that we will be making donations to the following organizations for their continuing relief work during the ongoing COVID crisis: the Saroj Gupta Cancer Center and Research Institute at Thakurpukul for procurement of medical instruments, the MCKS Food for the Hungry to support their sewing training school, the Disha Foundation to support the education of underprivileged children, Hamari Muskan to support education of children and sex workers, the Foundation for Innovation in Health to support the training of healthcare workers from underprivileged backgrounds and provide them with employment opportunities, the Sundarban Foundation under Ek Packet Umeed towards teachers' annual salaries, the New Light Kalighat towards education of children of the crematorium workers. We had promised our members that we would use a part of their membership subscription fees received for 2020 to contribute towards supporting distressed and disadvantaged citizens as extensively as we could. And today, we wholeheartedly thank you, members, for your continued support in helping us to stand by everybody in their unfortunate times. Thank you for your support. And now, Joydipta, congratulations to you. And I would love to ask you a little more about the work at Calcutta Rescue. So, do tell us, how was the pandemic? And what about the relief work, and what all have you done?
Firstly, namaskar to everybody, and we send our best wishes to Priya Sureji from Calcutta Rescue. I hope and her father are well. And to just want to say thank you, dear, to yourself as president of the Ladies Study Group, to the members of the Ladies Study Group, the Indian Chamber of Commerce as well for recognizing Calcutta Rescue for our outstanding contribution. But I'd also like to acknowledge you mentioned so many other worthwhile organizations, and there are hundreds of excellent organizations doing very good work and have been doing very good work over the pandemic period. But it's a tribute to my colleagues and that you have picked us out for our outstanding contribution. And I'd just like to pay tribute to my colleagues for doing something in the pandemic at a time, dear, which was your question, at a time when, if you think back to a year ago, we didn't really realize the deadliness of the virus, because what we were hearing was coming over from Europe, where the virus was creating havoc. And at that point in time, when it reached Bengal, we had a situation of how to react to the virus. Luckily, we had prepared ourselves because we have a lot of supporters and volunteers, particularly in the medical sector, who were guiding us from Europe. So doctors in the UK were telling us how to operate our clinics, how to maintain infection control systems within our clinic. So they were already advising us. So we already had prepared ourselves for the situation of the virus arriving in Kolkata. But what we hadn't prepared for there was the suddenness of the lockdown and the length of the lockdown. So many of our service users, particularly women, who are our patients, uh, we provide life change, vital medicines for, to keep them alive. They suffer from disease, and in particular, when the lockdown occurred, we had to react in the sense that our patients were calling us kind of frantically. So, if I just give you an example, a lady from the Sundarban who comes to our clinic, who travels by train, who suffers from a rare bleeding disorder, and if she doesn't get her medication to stem the bleeding,
Mm-hmm.
she could, it could lead to a very serious situation, if not a fatal situation. So when she was frantically calling us saying, I can't make it to the clinic, there's no transportation, how can I get my medication from the rescue? The pharmacies were closed, or if they weren't closed, she was unable to get that medication from the pharmacies or the hospitals because it was an expensive medication, which is why she had to come to Calcutta Rescue in the first
Okay.
place.
Okay.
So it was that type of phone call to Calcutta Rescue that we realized we couldn't sit around for too long, which is when we immediately decided that we had to reach our patients. If they couldn't come to us, we had to reach them.
Absolutely.
And because and at that point, we had a small group of people um, who were living around the clinic, who walked to work or cycled to work. And using our vehicles, we systematically began driving as far as we could to our patients, as far away as Sundarban in the south, as far away as Murshidabad in the north, delivering medication, and in many instances also delivering nutrition and food packets. So that's how it started. And
Okay.
then gradually, as the lockdown lifted, we were able then to systemize our processes in terms of slowly as the transportation opened up, bring our patients back into the clinic, but we couldn't do it in a way that we were doing previously because of social distancing norms.
Mm-hmm.
So we couldn't have 80 people in the clinic, which we normally have in our biggest clinic in Talabar. That would be too congested, so we needed to reduce that to say a third or half so we could keep
Mm.
social distancing.
Okay.
So therefore, we moved to a teleconsultation model, which is, so our doctors phoning the patients, making sure that they were well, making sure that they were okay, and then so they were then relaying any issues that they had over the phone, or even taking pictures by WhatsApp and video and sending
Okay.
those to our doctors. So that's how we started moving towards a teleconsulting model for our patients. And at the same time, we very quickly got into gear for our students who come to our centers by providing online education very quickly. I mean, the schools were shut on the 23rd of March of last year. By the first week of April, we were already
Yes.
conducting online lessons, which we gradually improved upon as the year went on in terms of refining the lessons and things of that
And
nature.
I love that. I love that bus that you showed us in the video. That's just
Correct. So,
amazing.
so that's how we're being a relatively smaller organization, we were quickly able to adapt. So we realized within a few months that the online education wasn't very effective for the very young children.
Correct.
Your
Correct.
preschool and very young primary children. So from that 4-year-old to sort of 7-year-old, 8-year-old bracket, online wasn't really. They needed that physical interaction with the teacher. So
Mm-hmm.
when we were able to, we then decided to send a mobile classroom to the slum areas. So those very young
Okay.
children could have, while maintaining all COVID protocols. So then we had a mobile classroom which is now visiting the slum areas.
Amazing. I saw that that video looked so encouraging, I think. So is that still on? Do you still have those mobile buses that are running?
Yeah, absolutely. In fact, yeah, we're expanding that. We have a new school building which is opening next year, a
Okay.
physical building, for which we would have required a school bus anyway. But we decided to buy that bus early now
Mm-hmm.
during the pandemic, which can actually go. So now we have two mobile classrooms visiting Islam communities for the preschool and primary school children, and it's
Okay.
proving really effective. The mothers are really grateful. I think you know as much as I do that even poor mothers, if nothing after putting food and shelter After providing for food and putting a shelter over their heads for their children, the next most important thing that they want for their kids is a good education. For them to not be
Absolutely.
have an education for 12 months has been so difficult for them. So when the mobile classroom started going, we received a lot of gratitude from them,
I'm sure.
that this was
I'm
happening,
sure.
and yeah, and it's working really well.
And it's a pity that, Supriya Suleji is not with us because I know she is so passionate about education, about educating the lesser privileged, and she is herself doing such amazing work in her own constituency. So she would have been so happy to hear about the work that you're doing at Calcutta Rescue. So is there anything else you would like to share with us about your work? Because
Well,
we
I would
have
just say,
you have a captive audience here who would love to know
effectively,
more. So tell us
hopefully,
some more about your work.
um, I just say that, and I mentioned it in the video. I touched on it. Is that things look like they're getting to normal. The buses and trains are running, and there's a lot of activity, and there's congestion on the streets. Um, where we are working, we are seeing an immense amount of distress. So it's almost like a mirage. You don't really think things are returning to normal because you're seeing the activity,
Yes.
but it's really at that level. It's not the activity and the economic activity has really
Mm-hmm.
been decimated, and it's a real struggle. And I think without trying to make everyone too despondent, I think we're on the cusp of a very difficult period this year.
Yes.
Um, Possibly longer. We don't know how long the sort of economic distress for our poorest citizens are going to continue for. And so it's up to all of us, and for us within people watching
Mm-hmm.
other, the civil society organizations, and Supreme if she was here, for us to really work together to try and ensure we provide and reduce the stress as much as possible, because it is at the ground level sometimes really heart-wrenching, and we have to systematically, as far as access to food is concerned, as far as ensuring
Yes.
education continuity, as far as ensuring healthcare access is concerned. All of those things need to be to make more. So it was difficult it's difficult enough for them pre-pandemic. It's been the IMF said that we're going to plunge another 50% of Indians into extreme poverty, and that means people within our slum communities, and an additional 50% will be plunged into extreme poverty. That's the IMF statistic. That's not my data, but that's the level of situation that we're dealing with. So um, events like this is absolutely important for us to put together, which we are doing, and we're very grateful that the Navy Study Group has acknowledged our contribution. Our tagline is also creating opportunities, transforming lives, which is similar to the Navy Study Group. Together transforming lives. So I think we're very much aligned, and that's what we need at this point.
Yes, and Yoedita, I want to add that through this process of working with your organization, I have met a whole lot of your team, and I have to say, each and every one is so dedicated and so devoted. You have a brilliant team of people working with you. So, full marks to Calcutta Rescue on that. I would now like to request my Vice President to join us. Sumatadi, can you join us?
Yes, I'm here. Well, we are really happy and delighted to give away the prestigious Ladies Study Group Charitable Trust Annual Award to very deserving Calcutta Rescue for their excellent work during the pandemic. We thank Khaitan family for sponsoring Shanti Devi Khaitan Award. We thank our governing body, past presidents, committee members, and all members for their support. Thank you all.
Thank you. Thank you, Sumatadi. And thank you once again, Jyotita, for a truly deserving award. And on behalf of Ladies Study Group today, I do want to take this opportunity to once again say to Supriyaji that we are missing you today, but we wish the very best to Sri Sharad Pawarji on a very speedy recovery. I want to add, I think that the pandemic has made us all introspect and think from a position not of panic, but instead of opportunity. And I know that hearing Jayadipta today is going to inspire each one of us to be more resilient and to work both on self development and on contributing to the society around us. We would once again like to commend all the NGOs to continue their relentless and consistent work through such difficult situations and be the rainbow in someone else's cloud. To all our members and viewers who have joined us today, thank you for joining us. Stay safe, get vaccinated. I'm sorry the webinar today is a bit shorter than normal, but we will all be praying for Sharad Pawarji's speedy recovery. Thank you so much for your time today.